So without further ado, it is my utmost pleasure to introduce our speaker today, Dr. Jonathan Patz. Jonathan is MD, MPH, a professor and John Holton Chair in Health and the Environment at the University of Wisconsin-Madison, where he also directs the Global Health Institute. Jonathan co-chaired the health expert panel of the first Congress-mandated U.S. National Assessment on Climate Change and served as a lead author for the United Nations IPCC panel. He is a co-recipient, together with the panel, of the 2007 Nobel Peace Prize. He has written over 100 peer-reviewed papers and 3 co-edited textbooks on global environmental health. So for our online audience, I will write the URL for his TEDx talk that was done recently on November 2017. And without further ado, up to you, Jen. Thank you.
Great. Thank you. And thank you very much. It's really a pleasure to be here on the West Coast. And I'm going to be talking about the health effects of climate change, but pretty quickly go into climate change policy and why mitigating greenhouse gas emissions could be the greatest health opportunity of our century. So I want you to take a look at this new data from Jim Hansen's group and pay attention to the extreme hot days, because this is what's really happening. This is northern hemisphere. It's not your imagination that things are warming up. So this is average summer temperatures, 1951 to 1980, 83 to 93, 94 to 2004, 2005, 2015. So things really are heating up, and especially extreme hot temperatures, which have health consequences. And when you think about, climate change, it's not just the mercury in the thermometer gradually creeping up. It's the increase in the extreme events. So a shift of 1 standard deviation, may as well use the pointer for the online audience. So a shift of 1 standard deviation makes a 1 in 40-year event become a 1 in 6-year event. So increased frequency of extreme events. Now, the Winter Olympics began yesterday in South Korea, and this is the New York Times headline of 21 Winter Olympic cities, many may soon be too warm to host the games. This is analysis from a Canadian researcher, Professor Daniel Scott from Waterloo, showing that in 30 or 40 years from now, you can see that Vancouver will not be reliable to host the Winter Games. And you can see Oslo, Norway, and these other countries, other cities, high risk of having Winter Games. So if you're interested in the Olympics, you're probably not going to see them come back to Vancouver. Now, we've done some modeling out of our group, looking at the future frequency of very hot days. And this is looking at New York City. And what you can see is that today, with today's climate, on average, New York has about 13 days, that are hotter than 32 degrees centigrade or 90 degrees Fahrenheit. But by mid-century, that number will triple. So instead of 13 days that are pretty hot, they'll have 39 days. This relationship held up for every city that we looked at east of the Mississippi River, that they'll have either 2.5 times the number of hot days over 32 degrees centigrade or tripling. Now, remember, it's global climate change, so you can't just look outside your door or outside your window and say, aha, it's hot or it's cold, and I'm going to make a conclusion of what's going on with global climate. I don't know if you read many headlines in the United States at the end of the year and around New Year's. We had freezing cold temperatures, and a particular individual in our administration talked about we could use a little bit of global warming, right? Well, that person didn't look at the global temperatures because this is on December 29th what the world looked like. So Canada and the eastern United States, very, very cold temperatures. But what color dominates the world on that day? So you can have changes in climate locally that have nothing to do with global climate averages. So you really need to look at the global picture. And this is actually this global weirding showing a non-uniform gradual warming that this is described by a researcher at the University of Wisconsin and also Rutgers University, where they talk about something called Arctic amplification. I'm sure you've heard of the polar vortex. And the reason, and I'm not a climatologist, I just defer to their work, is that when you look at the latitudes, the temperature difference by latitude actually drives the jet stream. So if the Arctic is warming twice as fast as the rest of the world, the temperature differential gets smaller and smaller. And that temperature differential drives the polar vortex winds. And so you get sort of smooth, curvy, jet stream. But as the Arctic is warming, the temperature difference narrows and the strength powering the polar vortex weakens. And so the jet stream deviates more. It gets wavier. So this is called Arctic amplification, that you can have extremely cold, crazy cold Arctic temperatures going down to Georgia, Atlanta, Georgia. And yet Canada and Alaska are seeing very hot temperatures. And so, again, remember, it's global. So when you see something like freezing cold temperatures in Canada, make sure you look at the rest of the world. And we will be seeing uneven warming like this as the Arctic warms up. Now, it's not just the surface temperatures that are warming. Sea surfaces are warming. And if you look at this green line, which is the annual mean sea surface temperatures in the Atlantic, and you compare it to the blue line, which is the power dissipation index, or the wind strength of hurricanes or typhoons, it's obvious that warmer surface temperatures drive stronger hurricane winds. And climatologists and oceanographers will tell you we can't really predict the number of hurricanes that will strike land, but the number of Category 4 and 5 hurricanes is increasing. So stronger hurricanes, pretty hard to predict, though, the frequency and whether or not they'll make landfall. So I want to shift to public health. We're in the School of Population and Public Health, so let's talk about the implications of climate change and the three main attributes being temperature rise, sea level rise from thermal expansion of salt water, but also from land-based glaciers melting into the ocean, and extremes of the water cycle, the hydrologic extremes, more droughts, more floods, and more fires, because hot air holds more moisture, so when it can rain, it rains really hard, and of course hot air evaporates soil moisture, so you get droughts. So extremes of the water cycle. And what this means for health is that there are many pathways that we're clear that we know that you have heat waves, and if you have a sprawling city with asphalt roads and concrete buildings, these heat-retaining surfaces, you get heat intensified and you get the urban heat island effect, and people die in heat waves. Air pollution and allergens, aeroallergens, we'll talk about sensitivity of pollen and ground-level smog ozone. Insect-borne or vector-borne diseases that are very sensitive to climate shift. Waterborne diseases, sensitive to extremes of the hydrologic cycle. And of course, our public health depends on adequate water and food supplies. And every one of these pathways of health have all sorts of climate-sensitive outcomes. Heat stress, heart attacks, respiratory disease, all sorts of vector-borne diseases, waterborne diseases. And I want to just focus for a second on this bottom one, mental health and environmental refugees. Probably the most difficult outcome to study because it's complicated with political variations, but I think it's the iceberg under the tip of the iceberg. Let's look at what happened in Syria right before the civil war. You might not be able to see this. This is rainfall is decreasing, temperature is increasing, a Palmer drought index is decreasing, and population is increasing. Just to make a long story short, a paper in the Proceedings of the National Academy of Sciences showed that right before the Syrian civil war, they had the most severe drought in the instrumental record. So those of you who are in demography or geography, you might be interested in these types of dynamics between social migration, natural resources, and scarcity of natural resources, and what ended up being a civil war. How much did this explain the civil war? Impossible to show. But the rural to urban migration rates, because of this worst drought ever recorded, the migration rates were 4 to 5 times normal. People were flooding into cities. And there were the price of bread, the food price shocks, people were rioting the streets. Did this severe drought, worst ever recorded, contribute to the Syrian civil war and subsequent hundreds of thousands of deaths and millions of refugees? It's worth study, and I think it's probably contributing, but again, hard to disentangle this. So some direct effects, we all know that heat waves kill people. The European heat wave was a disaster. Were any of you there in 2003? You were there. Okay, at least 2 of you. There was a spike in temperature and a spike in mortality. An estimated 70,000 people in Europe died in that acute heat wave. That is a public health disaster. And that event was so rare. I mean, the climate science say, hey, that 2003 heat wave was a 1 in 500 year probability event. Very rare event. But a similar heat wave happened 7 years later in Russia. It was over 100 degrees Fahrenheit, 38 degrees centigrade for an entire month. Over 50,000 people died. There were crop failures, big loss. The climatologists say these mega heat waves, extremely rare events from 2003 and 2010, 1 in 500 year events, are going to be increasing. And the probability of these extreme events, already from the greenhouse gases that are in the air right now, have increased in probability of 5 to 10-fold. So the 1 in 500 year event becomes a 1 in 50 year event. Very important for public health planning. Most cities are too hot to host Summer Olympics. This is another Olympic story. We saw the Winter Olympics. This is a study led by Kurt Smith at Berkeley University, and he showed that by the end of this century, only 8 of 543 cities outside of Western Europe would meet the low-risk category, especially if you're running a marathon. And if any of you are into occupational health or occupational medicine, you know about heat stress, which we're about to go into and talk about. And runners are, marathon runners are at the top level. If you run a marathon and it's too hot, you risk dying from heat exhaustion. So let's shift to occupational health a little bit. And you know that as far as the risk to the body, it's the issue of external heat and internal heat. How hard are you working and generating heat internally? And as far as the external heat stress, you need to factor in temperature, humidity, wind speed, and sunlight. And most of you are familiar with the heat index, temperature and humidity. But for occupational health reasons, it's important to look at, wind speed for wind chill, and also sunlight, radiant, infrared radiant heat energy. So wet bulb globe temperature. How many of you have heard of wet bulb globe temperature? Okay, everyone in your department, of course. I see lots of hands up, so Hind, you're doing a fine job. No problem, good. All right, so wet bulb globe temperature. Now, the military has a lot of experience with this already, and so they base their training regimen around these risk factors, and they use the wet bulb globe temperature, and they have these different flags. So if your combined wet bulb globe temperature, all those indices together, give you a wet bulb globe temperature of 26.7 degrees. Well, that's okay, but they're saying extreme intense physical exertion may be a problem. Be cautious. If you get into this wet bulb globe range of 26.5 to 29, then, be more careful. And so on, yellow, finally get up to red here. Strenuous exercise must be curtailed for everyone. And then the black is no strenuous exercise. Suspend all exercise, all training, So the military takes this very seriously. They know how dangerous external heat is. And if you're generating internal heat by more physical exercise, you need to be careful. And as far as labor capacity, there's a pretty well-defined level of labor depending on the wet bulb globe temperature. And so you can see that as the amount of labor, here you can, if it's cool out, if you're less than 26 degrees wet bulb globe temperature, you can, work 100%. You can work hard, not a problem. But as the wet bulb globe temperature increases and increases, look at the amount of work that you can do. Certainly heavy work here, but no more heavy work down here. And then moderate to light work, and down here only light work. So this is an issue with labor, and there have been some projections for the future for climate change. How many of you know about the UN Intergovernmental Panel on Climate Change, the UN IPCC? Okay, so you know about their different scenarios. This is RCP, representative concentration pathway of how much greenhouse gases we're going to pump into the atmosphere from burning fossil fuels. This is a decent scenario that we're going to reduce our emissions, but the red one, representative concentration pathway 8.5, that's like business as usual. We're going to just keep burning fossil fuels. We're not going to change our behavior. And if we do that, that's this red line scenario, that by the end of the century, 2100, outdoor labor will be reduced by 50%. So working outside in the daytime, you're going to cut labor production by 50%. So, that's an issue for workers. It's an issue for GDP and, generating income. And there's a special case which I confess I just learned about. Any of you in occupational health, you have to know this case study about climate change. It's sugarcane workers and chronic kidney disease. How many of you have heard of chronic kidney disease in workers? Some of you. Well, I just learned of it just a couple of years ago. It is rampant. These are 40-year-old males that are dying from kidney disease. It's happening in Latin America, especially in sugarcane workers. You have to burn the sugarcane to harvest it, so it's hot already, and then you're burning it. Look at what the wet bulb globe temperature, these are some workers in, where are they? Somewhere in South America, Central America. And they start work at 5:30, and by 9:30, the wet bulb globe temperature is already above the limit for, let's see, 930. That's above 26 wet bulb globe temperature. So you're talking about a stressful situation. And by 10 o'clock, 10:30, you're talking about you should work 25% and rest 75% of the time. So multiple cases of dehydration can be a stress to your kidneys. And if you drink high fructose liquids, that can serve double damage to the kidneys. So depending on what you drink, if it has high fructose, you can, shock the kidneys and cause damage. And this is an occupational health hazard that is all over Central America and in India as well, and other parts of the world. But this is something that I couldn't believe how prevalent it was. It's a big problem. So another big public health issue is nutrition. And the top map is projected summer temperatures by mid-century, and the bottom map is by the end of this century. Let's focus on this. End of century. Everything in red has a 90% probability or greater of experiencing the hottest summer temperatures in their historic record. And what that may mean for crop production, because of the climatic envelope in which crops grow, is that by mid-century, the number of people at risk of hunger, that's about almost 900 million people right now are at risk of hunger, that could double by mid-century. That is an enormous public health burden. But some plants may benefit from warmer temperatures and more CO2 in the atmosphere. Ragweed pollen. Look what happens in Canada and the northern U.S., that the pollen season for ragweed is already increasing, and that is because of warmer temperatures and CO2. This is in my state of Wisconsin. CO2 has increased by 27%, and our state has warmed 1 degree Fahrenheit. The pollen season has increased almost 3 weeks. Ragweed pollen does well with warmer temperatures and more CO2. So these weedy plants, and also poison ivy, by the way, poison ivy and ragweed will do very well with climate change. So on the one hand, you have some problems with nutrition and crops. And by the way, with the crops, people talk about CO2 fertilization and bigger leafy plants, but they have less protein. So protein deficiency, even if crops do well with CO2 fertilization. Those are newer studies that have come out as well. But here's something with aeroallergens and climate. And actually David Suzuki in Canada he's got a slide that says, global warming's greatest threat will be its smallest. And a picture of an insect. So what's the difference between us mammals and an insect like this mosquito? Hind promises, besides the fact that you can't fly, and Hind, she promised me that most of you, not all of you, but most of you don't suck blood, right? Promised me that, right? So what's the big difference between mammals and insects? Mammals are body temperature. We're warm-blooded, so our temperature is always about the same, more or less. But what's the body temperature of this cold-blooded mosquito? It's whatever the air temperature is. And if the air temperature changes, the body temperature changes, and if that mosquito, which happens to be Aedes aegypti mosquito that carries yellow fever virus, dengue fever virus, and Zika virus, whatever the air temperature is, that dictates the speed of development of the pathogen inside the mosquito. This holds for malaria parasites in the Anopheles mosquito, and it holds for these viruses in Aedes aegypti. So, when people talk about go back. People say, yeah, so in Wisconsin, it could be, 20 below zero in the winter. Centigrade, Fahrenheit, they're whatever, similar, whatever. Down there, they're similar, get to be similar. So 20 below zero. And in the summertime, it's, gets up to 32, 33 centigrade, or, 95 degrees Fahrenheit. Who cares about a half a degree of temperature or 1 degree? Big deal. Well, it's a big deal for diseases that go through this biological system that includes a cold-blooded insect. A small fraction of a degree change in temperature can change transmission dynamics of these diseases. Now, dengue fever, which is the most prevalent mosquito-borne virus in the world, has a seasonality to it. It goes up and down, and it peaks in a certain time. In South America, it peaks in the springtime, in March and April. In Southeast Asia, it peaks, I can't tell by this map, I can't tell exactly when it peaks, which month, but it's seasonal, okay? So, up and down with seasons. But if you look at this 18-year record of seasonal dengue fever, you get these 2 years that light up in red. So what is going on? Okay, these are definitely different years. Well, it turns out those were the strongest El Nino years. And El Nino in this part of the world meant warmer temperatures. So even if you expect warm temperatures in a certain season, El Nino sort of spikes the temperature that much higher, and you happen to see a big response. And this El Nino of 1997 was the strongest El Nino in recent history until 2 years ago. The El Nino of 2015 was equally as strong as 1997 and lasted longer. And look at the temperatures over Latin America, over South America. These were unprecedented temperatures in the 50-year record that we studied. And it turned out, if you look at the risk of that mosquito, the vectorial capacity of that mosquito transmitting dengue fever virus and Zika virus, it turns out that that period of the El Nino was had the strongest vectorial capacity of transmission in the last 65 years. So, it's a complicated situation about, favelas and housing and conditions for dengue fever transmission. But as far as climate suitability, that period was the highest, had the highest suitability for transmission in the last 65 years. I'll just show you one more study that we did with El Nino. Because of the seasonality of disease, it's very hard to figure out climate suitability, climate attribution. This is daily hospitalizations for childhood diarrheal disease in Lima, Peru, up and down, up and down, up and down. And then they had that strong El Nino of 1997. So a perfect time to control for seasonality. Doing a time series analysis, you need to control for seasonality and have enough years to do it. And look what happened. So in 1997, the winter was 5 degrees centigrade warmer than normal. So there was sort of not really winter. So we compared the observed versus expected and found a 33% increase in admissions for diarrheal disease during the El Nino. So it's a great way to sort of control for seasonality in your studies by using El Nino. And so we found that for every 7-degree increase in daily, 7% increase in cases with every degree centigrade warming. So this is, again, another study showing that anomalous climate conditions can have a health impact. Now, are any of you climatologists or from climate sciences? Oh, good. So I can say anything I want, right? But the climatologists say, don't call it global warming. It's more than that. It's also extremes of the water cycle, the hydrologic cycle. So this is from the U.S. Climate Change Research Program. And this is showing that in the future, this is a global average for what will rainfall look like. Will it look like drizzling Vancouver and Seattle, or will it be like heavy downpours? And you can see that in the future, the nature, the type of rainfall will be heavy downpours. Well, already we have trouble handling heavy rainfall and runoff. We get what are called combined sewage overflow events, where the urban system simply cannot handle all the rainfall, all the runoff. And so we get these combined overflow events already. Well, we modeled what would happen for the Chicago area and found that for the future, and because of projections for heavier rainfall events, that Chicago could see a doubling in the number of combined sewage overflow events. So that's a risk to our drinking water. And if you go to a place like Milwaukee, which is on the shores of Lake Michigan, look what happens to the recreational waters right after a heavy rainfall. Look at these, this is from dipping samples of E. coli bacteria. Look at South Shore Beach that lights up flaming blue hot, high levels of E. coli bacteria. Bradford Beach, pretty red hot, high levels of E. coli bacteria. So a risk, heavy rainfall, and a risk to recreational exposures from the intensity of the rainfall. So because I'm in Canada, and I'm from the United States, although right now I claim to be Canadian, I have to say that North America, there's a dimension of climate change that we have some responsibility and ownership. The U.S. is the worst, but you guys are, with us, you're pretty bad. We're energy. Although British Columbia is pretty good, you know, you've got carbon tax and you got a high awareness, but the rest of Canada, I'm going to lump all of Canada together, just like the U.S. But I can say Americans, and I think Canadians would hold the same, per person, we emit 6 times more CO2 than the global average. And this is a data-driven cartogram. We did this 10 years ago, and what you see on the bottom map, these are climate-sensitive diseases that at first, places like sub-Saharan Africa and India, where you've got lots of malnutrition, malaria, and diarrheal disease, are going to suffer the impacts of climate change the most. But if you look at a 50-year aggregate of pollution, greenhouse gas emissions, especially CO2, look at Africa. Is Africa responsible for today's climate change? No, not at all. Look at the United States. Oh my God, you know, the United States is the #1 most responsible country for today's climate change. Now China is, you know, now they're polluting a lot, although they're investing, you'll see in a minute how much they're investing in renewable energy. But the United States is the #1 most responsible. So this study got a lot of attention, and after we published this, a couple of years later, I got an invitation from His Holiness the Dalai Lama to present on the ethics of climate change. You know, ethics, health, and climate change. And I showed him that map, and you know, the Dalai Lama is a really smart guy. And he looked at me, he said, Jonathan, if you know pollution kills, your country is not showing much compassion, correct? You know, you look at that map, like we're burning all this energy and we're killing people in other parts of the world. And I started to say, Your Holiness, it's complicated. And then I sort of caught myself and I said, let me get back to you on this. And I thought about his question, because we know pollution, we know it's a problem. And, you know, we're a fossil fuel-based society. But the more I think about it, especially through the public health lens, the more I thought, you know, this could be a great opportunity. Because if you think about getting off of fossil fuels, what does it mean? It means less air pollution. It means cleaner energy. If you look at the energy sector, I mean, air pollution kills 7 million people every year. That's more fatalities than AIDS, TB, and malaria combined every year. And you guys in this department know the problems of air pollution. So if we get to a low carbon energy system and thinking about climate change, greenhouse gas mitigation, you know, that's great, but you also mitigate all the other nasty pollutants. Immediate health benefits and large health benefits. Another sector, transportation. Some new studies are showing that because of our automobile dependency, we're fostering a sedentary lifestyle, and physical inactivity, according to this study and also the global burden of disease studies, kills more than 5 million people every year. So sedentary lifestyle and transportation policy, both of these things, energy and transportation, that is public health policy, absolutely public health policy. But you know, you think about, well, what will it cost to have cleaner energy? It might cost a little bit more for renewable energy. According to this study by Jason West et al., it might cost up to $30 to avoid emitting 1 ton of CO2. But when you burn coal and oil, you know, you emit CO2 and greenhouse gases, but of course you emit PM 2.5, sulfur dioxide, you know, all these other things that we know harm health. So much so that for every ton of CO2 that you avoid emitting, you have a $200 health benefit from avoided mortality and hospitalization. So I asked the policymakers to take a deep breath, because I'm going to ask them a really difficult question, you know, which number is bigger? And the problem is, you know, the policymakers, they're just focused on this $30, you know. We don't want to pay more for energy. But it's really critical to put this forward and make sure that public health benefit is captured. And this is the role of government. You know, when a company builds something and they're processing something, they're responsible for the waste product. That's why we have environmental protection to protect the community downwind or downstream. And companies are responsible for their cleanup. Well, also fuel industry, they sell gasoline, oil, coal. They don't pay for when people burn it and it goes up into the air. They have no responsibility. It's terrible. So this is where it's absolutely required, and the role for government to protect the public and to reap this huge dividend, this public health dividend. Extremely important. And if you live in places like China or India where air pollution is very bad, you know, these benefits are huge. So remember this slide when people say, yeah, we don't want to pay more, it costs more for clean energy. Say, have you thought about the health benefit? Because you have to do that. You need to do the full assessment. And oh, by the way, that $30 might be completely wrong. Look at the price of solar energy. It's dropped 99% since the mid-70s. Solar and wind have dropped 80% and 30% respectively just in the last 7 years. So it might not be $30. It might be $10, you know. But anyway, this is something where we're not waiting for the solution. The solution, we have plenty of solutions already. We just need to enact the policy. Well, you get this argument. Yeah, what about the jobs? You know, and I'm from the southern province here, where we're still in denial in our U.S. Congress. But look at the U.S. Energy Employment Report that came out last year. 1 million U.S. jobs in renewable energy. That's 5 times more jobs than in coal, oil, and gas for energy combined. So the jobs argument is just false. It's not there. And in public health, you know, jobs mean income, and that's health. So there's, you know, green technology and green energy jobs, there are lots of them. So I want to shift gears, literally and figuratively, and talk about transportation opportunities. So in my country, the U.S. transportation contributes to sedentary lifestyle. 60% of Americans do not meet minimum levels of physical activity, of 30 minutes of moderate exercise every day. And 2 years ago now, but I'll call this last year, obesity rates in the U.S. hit 40% in adults. 40% of Americans obese. More than overweight, obese. Oh my God. 18% of children. 600,000 Americans die of heart disease every year. Now here's the thing. 40% of trips by car are less than 3 kilometers. You know, easy by transit, decent transit, and walking, or certainly by biking. So, golden opportunity here. And if you compare American cities with the highest rates of walkability and bikeability, in the good cities with highest rankings, obesity rates were 20% lower, diabetes rates 23% lower than the cities that had poor rankings. And of course, exercise also reduces heart disease, cancer, dementia, and depression. We did a study in our region where we mapped where are the cars traveling, where is the exhaust emissions from those cars, and then taking those emissions, modeling, here's the air pollution, where does the air pollution occur, and then superimpose that over census tracts of where people live. And others. So we asked the question, what if we took those short car trips off the road only in the cities? For the 11 largest cities, take the car trips off the road, what happens to air pollution and what's the health benefit? Question number 2, what if those short car trips, what if we can say that half of those short car trips that are taken off the road turn into bicycle trips, and we're practical, sort of, although I do have studded tires on my bike, but let's just do it in the summertime. So 4 months of the year, half of the car trips that are off the road now turn into bicycle trips. What's the added physical fitness benefit? And cut to the chase, the headlines from our work was that swapping tailpipes for pedals, small changes could pay huge dividends for public health. In our region alone, we'd save 1,300 lives every year. That's equivalent of $8 billion every year saved from avoided hospitalization, absenteeism, and mortality. So, you know, little changes here. Now, of course, you know, you have to talk about accidents and fatalities. But when you look at the incredible public health opportunity, this is sort of impetus for urban planners to say, wow, if you can have that much health benefit, we need to design alternative transportation so it's safe, so that people can reap this health dividend. So in wrapping up, I want to just talk about, you know, prevention. You know, we're in public health. We're in the School of Population and Public Health. So of course, we know one of our biggest health challenges has been tobacco. And one of our greatest intervention was raising the price of cigarettes. And when we raised the price of cigarettes, youth smoking dropped dramatically. So like tobacco, and because climate change is a health issue, it's time to put a price on carbon. And in British Columbia, you guys have done that. You're ahead of the game. Good luck convincing the rest of Canada and your southern province. But, you know, the other challenge, and it's important for all of you in this field to know about it, wow, oops, sorry, just got hooked my cord, is, I think that was intentional. Somebody just tried to unplug me. Because parallel to the tobacco industry, you know, the fossil fuel industry, they have massive disinformation campaigns. and plenty of money being fueled into politics. It's really challenging. So it's really important to get this message out that, climate change, number one, it's real, it's happening now, and it's about human health. It's not just about polar bears, it's not just about biodiversity, it's not just about environmental issues, although it is. A lot of people, you guys in the School of Public Health, it's a health issue already. But most of the world still doesn't see climate change as a health issue. So pound that in, that it is absolutely a health issue and that it's really happening. And if you ever look at websites, absolutely know what the source is. But here's another thing you can talk about. If people are trying to obfuscate the truth on climate change and muddy the science, I'd say that regardless of one's views on climate change science, and if you just forget climate change, just say it's real, it's happening, but let's forget it. No, I'm not going to think about climate change. Everyone, I think, can support safe routes to schools, physically fit children and adults, from cities designed for people, not just for cars, clean air from low carbon energy, even if you forget about climate change and climate change mitigation, just having clean air, green jobs and lots of them. There are so few jobs in coal mining, preserving natural resources for a healthy future. So you could go into a conversation and say, and usually I go into conversations and I don't talk about climate change up front. I talk about, well, let's just talk about clean energy and green jobs and healthy children. You don't even have to talk about climate change to talk about what you would do for a low carbon economy, and it's really a great opportunity for health. So I can ask you all to spread the word that indeed climate change is about health. And if you like this presentation I just gave you, send your networks about this and send policymakers. Much of this presentation, a little bit more for a lay audience and a bit shorter. If you just Google my name and TEDx, this just was released last month. And so this presentation that I'm giving you, the 19-minute version of this, with some of the science slides not included, is TEDx. And so you can sort of send that around to your network, and especially your friends in politics, so that they know. So I'll conclude by saying that confronting the global climate crisis is the greatest human health opportunity of our lifetimes, and we can't afford not to take that opportunity. So thank you very much.
Thank you so very much, John, for this absolute tour de force showing all the facets by which climate change impacts health. I am going to give a moment to our audience here to think about their questions. I will start with a few that have been already starting to pop in online.
Okay.
So the first question, I'm just going to take them as they come. The first question was related to that example that you gave on occupational health. So one of our listeners is asking, are there examples of studies that integrate over scales and related systems? For example, in the sugarcane worker example, their health is associated with extreme dehydration brought on by occupational extreme heat. But at the mesoscale, there may be regions where water continues to become more scarce. Would it be possible to tease apart the effect on kidney outcomes from the occupational heat exposures and from regional water scarcity?
So that's a good question. It's a tough question for me to answer, other than to say that I think when you think about water resources, drinking water is, a tiny drop in the bucket, no pun intended. But, compared to water availability for crops, that's our biggest, crops, industrial processing and crop production, that's what you need a lot of water for. As far as drinking water, it's mostly occupational interventions and, getting shade and drinking water and, doing rest breaks and things like that. I think that water scarcity and drinking water would be, I think there should always be plenty of drinking water. Just not enough water to support crops. Yeah.
Thank you for this wonderful presentation, and even though it's a very depressing topic, you managed to make us laugh every now and then. That's much appreciated. So you raised a few opportunities where the benefit to human health is can be combined with a benefit to climate change, and I just wanted to maybe point out another opportunity where that is possible, especially when we talk about non-communicable diseases like obesity, diabetes, cancer, and that's when it comes to nutrition and what we call the standard American diet. And considering that animal agriculture contributes about 14% to our carbon emissions, I think that's another area where we could see a combined benefit.
Absolutely. I give another variation of this lecture where I talk about energy, food systems, and transportation, because the food systems is definitely a big piece of this. If you look at what it takes as far as CO2 equivalents of energy and water and land, red meat is the worst. And then I think pork, and then chicken, and then salmon, and then sheep? Cheese, okay, dairy, and then, vegetarian, and then vegan. So the lower you eat on the food chain, the better. Certainly in North America, we have a wild abundance of overproduction and consumption of red meat. And so, especially in developing countries, meat is really important. Meat and cheese and dairy, because they have such little supplies. But in wealthy countries, eating
Thank you, Dr. Patz. Is there a recording of the conversation you had with the Dalai Lama? No, that's not my question. But anyways, yeah, thank you. So when I think climate change, three things: mitigation, adaptation, resilience. So I'm going to ask three questions, more or less related to those, which could lead you to give another lecture altogether. First question, carbon capture. We all know that carbon dioxide levels still rising. Are you aware of any promising results in efforts related to that? First question. Second question is, how many jurisdictions in the U.S. are you aware of that's undertaking vulnerability assessments? Number three is regarding resilience. How can public health do better in building the baseline health status?
Married yet? Yeah, Okay. Oh, no, it's dead. All right, hold on. Okay. Yeah, okay, yeah. So, no problem. So as far as carbon capture, of course, I'm not the expert in that, but my problem with carbon capture is that there's no health side benefit. If you're just focused on carbon capture, if you capture all the other, PM 2.5 and everything else and do, mega scrubbing as part of your carbon capture, great. But if you're just focused on CO2 and carbon capture, there's no health benefit unless you're getting all the other side pollutants. Your second question about vulnerability assessment, very few, I'd say not many places are doing vulnerability assessment. Very few cities even have a heat early warning system. Some do. Chicago does. Milwaukee, there's some. But very few cities have any preparedness for that. And your third question was? Yeah, so that's a great question. What I tell public health officials and professionals is that when you think about climate change, please don't think about it's another topic on top of your already full plate of problems you're dealing with. It's like, I'm dealing with this, this, and this. I can't add another thing. Climate change will exacerbate all the things you're working on. Water contamination from extreme floods and runoff, heat waves, more frequent, vector-borne disease. There are going to be shifts in geographic location and seasonality of disease transmission as well as allergens and things. So things you're already working on. So that's where if you're working on water systems, you need to build in extra resilience for more extreme events. So it's a really important message to talk about how climate change cuts across the things you're already familiar with. So you need to be building resiliency, to that level for future projections. All right, I'll let you do the running.
Thank you. Great presentation. I really appreciate the last slide that you just showed us with, try not to be political about climate change. But based on my own experience with talking about climate change, the moment you talk about climate change to anti-climate change groups, they just turn, their face, they don't want to talk, they don't want to listen to you. So I just wonder if you have any experience dealing with anti-climate change groups. Of course, there are a lot of people, followers of, DJT. I was wondering if you have any experience or any success story to deal with those climate change groups.
Well, you're really teeing me up, because one of the reasons that I'm here is that I'm giving, do you know David Suzuki? So I'm giving the next keynote after David Suzuki tomorrow for Rotary International. So Rotary International is a big, international group. And this pin right here happens to be the Harris Medal from Rotary International. And I'm wearing this pin because they told me I better wear this for tomorrow, right? It's the Paul Harris Prize or medal, and it's from Rotary International. So let me go back in time, just a few years, I don't know, maybe 3 years ago. I was asked by the new Environmental Sustainability Rotary Action Group. It's a new action group for environmental sustainability, a small group in Rotary. They said, could you speak at to our little group in Madison, Wisconsin about climate change and health, but don't say the words climate change. I said, no problem. I can talk about extreme storm disasters, heavy rainfall, heat waves, and how that can affect, polio eradication and more stress, piece of cake. And it was very intentional. Here's your audience. Don't dare say climate change. So I didn't say climate change. It went over very well. Within 1 year, they invited me back. They said, could you speak to the entire group. It's a very big, Madison, Wisconsin has a huge chapter for Rotary. Speak to the big luncheon thing. And by the way, you can talk about climate change now within 1 year. I don't know, So that shifted. And now, and I've given a couple keynotes. I gave one in Korea and one in Atlanta. And, the president now of Rotary is very conservative, very conservative. Plenty of people that would not believe in climate change. But the president of Rotary is now saying we need to plant trees, this meeting of Rotary, it's called the Presidential Peace Building Conference. There's one of 6 around the world for the president of Rotary. So this one is focused on environmental sustainability. And so I'm speaking about climate change specifically, giving a talk similar to this, but shorter. So the lesson is, in general, if you have a group that you are pretty sure that's they're not already on board with you, you don't want to be in the echo chamber, right? That I don't start with climate change because you don't want them to shoot the messenger before they hear the message. And you can just park climate change in the back and talk about the health of extreme climate events. And then you can bring in later, like that. I think one of my first slides that Jim Hansen's group showing measured, not modeled, measured summer temperatures from 1950 and showing that, saying, oh my God, it really is warming. That audience does not believe in future modeled scenarios. You got to show them the historical evidence. So yes, I have dealt with that situation, including speaking on climate change without saying those words. And if you're in, company that you think, they're not going to buy this, I would steer away from climate change. And this, as you said, that second to last slide, even if you don't believe in the climate science, we can all agree that a low carbon society and the health benefits, especially from clean air, healthier food, and healthier transportation, has enormous benefits. I didn't show the trends in obesity around the world. Every region in the world, it's going like that. Obesity and diabetes, these chronic diseases. So forget climate change. Just talk about chronic disease and healthier cities, where people can move around by active transportation, walking and biking, and breathe clean air. So great question.
Basically, it's like cutting veggies so small that your kids can eat their veggies. So please join me in thanking John again. Thank you for being here. Thank you for this talk. And we hope to have you again.